So one of the challenges when we look at doing complex spinal surgery like scoliosis surgery on adults, particularly adults over 55 or 60, can be bone density issues or osteoporosis. So one of the things we really look at when we're trying to figure out if somebody's a candidate for reconstruction, if they're having a lot of symptoms, are what's their bone density. So frequently, if we do a bone density check with a DEXA scan and somebody's bone is very soft or very osteoporotic, we oftentimes have to work for 6 months or a year with the endocrinology teams to try to get the bone density acceptable enough that it will hold spinal implants. Because if you go in and try to do scoliosis surgery or a big correction of a spinal deformity with bone that's built like styrofoam, it's very difficult to, number one, get correction, and number two, to hold the correction with implants. So it's something we screen on almost everyone over 55 who are considering for reconstruction to confirm that they don't need optimization of bone density before considering surgical reconstruction.